viewers. Welcome to Spill It on Afric HTV. It's a podcast program coming to you from Afric HTV, located at Obokun Avenue in Elisha, Osun State, Nigeria. Here with me, I have a special guest, a doctor, and also two other guests, looking at a topic titled drug abuse, drug addiction, and drug peddling. But before we move further, let me quickly introduce to us my guest. The guest speaker is in person of Dr. Addict Omowonuola Aditoyi. He is a consultant anastologist at the Obafemi Awolowo University complex in Ile-Ife. He is also the former NMA chairman of Osun State chapter from year 2022 to 2024. Dr. Addict Aditoyi, welcome to the program, sir.
Good day, viewers.
All right, thank you very much. And to his side there, I have another guest.
Omoba Oyebanji is my name. Omoba Ademiwa James is my name. I'm a social observer and an analyst. Thank you for having me here.
Thank you for coming, Omoba. And to my right here, I have a beautiful lady here who will also be analyzing with me on the topic. Madam, you're welcome, please.
Thank you very much, sir. I am Chiamaka Modesta.
All right, Chiamaka, you are highly welcome.
Thank you very much, sir.
All right, doctor, permit me to address you as doctor, as in ordinary doctor, because of our time. The topic before us this day says drug abuse, drug addiction, and drug peddling. Please, briefly, can you expatiate or tell us what do we mean by drug abuse, drug addiction, and drug peddling?
Thank you, moderator. Good day, viewers. These terms are used interchangeably, but they don't mean the same thing. Drug abuse, as a larger extent, is simply the misuse of drug when it is not prescribed or when it is not warranted. But drug abuse has to do with a health challenge that's affecting the brain, that is making the individual to impulsively seek for drug, use drug, even at his own detriment. Even when he's coming to harm by the use of this, he still wants to have it and to use it. It's otherwise called drug use challenge. And drug peddling is a term used when people try trafficking drugs or moving the drug from one point to the other, getting it through to those who want it at all costs. And most of the time, this applies to illicit drugs more than the regular pharmacological drugs. That would be the simple way we can understand the difference between drug abuse, which covers a larger extent. In fact, somebody who buys paracetamol when he doesn't need it is abusing drug, despite the fact that paracetamol is not a drug of abuse. But when you are talking about addiction, this fellow is impulsively seeking this drug, using it, even when he knows that this drug is harming him, still he wants to take more of it. And the peddling is the aspect of either transporting it, selling it, distributing it, just getting it through to those who need it. And this most often is applied to illicit drug.
All right, thank you, Dr. Adidakpo. That is, we have heard from a doctor what drug abuse is, drug addiction, and drug peddling. But let me go to my analyst, one of my analysts here, Chiamaka. Chiamaka, what is your take or what's your view concerning drug abuse, drug addiction, and drug peddling.
Okay, so from my own angle, I think I can actually say drug abuse is a excessive intake of drugs. It might not be just illegal drugs. It can come through a medicine or illegal drugs too. Once it's excess intake of it into your health, that's drug abuse. Then we look at a drug peddling. Drug peddling is a transportation of drugs or selling of drugs to the buyers or the users. Then that is a drug peddling. You're moving it from one place or one unit to another. That is peddling. Then a drug addict or drug addiction is someone who is addicted to a particular drugs. Someone who is will I say someone who is actually taking one particular drug, knowing fully well that it is very harmful to his or her health, but insists in taking the drugs. I think that person can be called a drug addict.
All right. Thank you, Chamaka. Let me move on to my second analyst, Omaba. What's your take?
Well, my own take is not far-fetched from what the professional in our midst have, said, about the three norms: addiction, peddling, and which one is the third one? Abuse. When someone is addicted, to me, from my own perspective, like I once read it in one magazine that Coca-Cola was actually a drug at a time when it was initially produced, before it now became what everyone. In fact, it was produced for the purpose of headache, from my finding. Before it now eventually became what everyone is drinking. Now you take note. I know of someone that would say, I cannot. My doctor say at any time I'm feeling so weak, I must take Coca-Cola. I was like, how can a doctor prescribe Coca-Cola for you when you are feeling weak? And for me, as a layman, I know if you take too much of sugar, it causes something else in your body, And this person often takes Coca-Cola every day. That at any time, she's feeling weak. So I see that as an addiction, in a way, like a medical practitioner here rightly said, that when you are used to a particular drug, virtually every day. There are some persons that every evening they will take, they will tell you that they need to take, what's it called? Multivitamin, so that it can boost blood in their body. They will need to take Panadol or paracetamol because they kind of, they are having body pain and all those kind of stuff like that. There are people like that. That's addiction. Now, when we're not talking about abuse, I think the addiction and abuse goes pari passu. Mm-hmm. When you are addicted in a way, you abuse the drugs you take, And the third one, which is peddling, in our society today, it is something that is appalling, very, very appalling. In fact, even amongst the youth, you see all sort of substance that are not, are not kind of pleasant. It's so shocking, it's alarming. It's one problem that I think our government really needs to deal with. At a time when we were growing, something like cannabis, anyone who indulges in taking of cannabis, what Yoruba call Igbo, they do it hiding in taking it. Yeah. But right now, in the present day now, you see people in the open. They take it, and you even wonder that these people are supposed to be apprehended by police or stuff like that. You see our policemen will even pass by, and this thing is very common in most of our garages, motor parks. That's where you see more of these things. That you see people taking this cannabis with reckless abandon, and they don't care. Before we start talking about these substances like Colorado.
Yeah.
They call it ice. They call it and loud and all stuff like that. You see them, misbehaving. And you go to some clubs, you see this thing where people will sit around it and
Shisha.
they
Shisha
take it,
That's
shisha and stuff like that. Yeah, I keep wondering, what's our society turning into? So these are substances that are seriously affecting our youth, and I think the government of the day, should really look
Into it.
That's
Right.
my own.
Thank you, Omaba. From what Omaba said, Doctor, I would like to pose a question to you, sir. I could remember my mom telling me at a point in time when I was very weak because of stress or what have you. She asked me to take a particular drink. I won't want to mention so that the marketing department will not come for my head. It has a lot of sugar. Now, he said, some people taking this drink every now and then, saying, I'm weak, I need to boost my immune system, I need to boost my energy, boost this, boost that. Can we call it drug abuse or
What?
what's your take on that?
Well, it all depends. We can't, in science and in medical science particularly, we won't go that way. We have a specific description for each term, like I said earlier. When you are talking of an abuse, it might simply mean that drug might be legitimate, it might be normal, but if you are using it for the wrong reason, or it was not prescribed, then we say you are abusing drug. Then the issue of addiction may fall under some part of abuse, may come from an abuse. Let's now talk about the sugar-containing drink that you spoke about. That drink that was mentioned earlier on contains sugar and contains a level of caffeine.
Yeah.
We don't know what the full content is because that's the secret of that particular drink. So nobody knows the full content. But those two things are present there. And if you look at them very well, one of them can easily be abused and you can get addicted to it. That is the caffeine.
Yeah.
Because caffeine also relieves pain. It's a form of analgesic. It can relieve pain, but in certain quantity, not in the quantity in Coke, definitely. The sugar content could make people who are weak to come up, become stronger, because when you exhaust, body needs sugar. As long as they are not diabetic. Because in diabetics, the problem with them is that they lack insulin, which is the key that opens the cells of the body to sugar for body to use it. Body needs sugar. So when you are exhausted, you've worked for a long time and you burn off your sugar content, and most likely you mobilize some from your store and you are getting exhausted. Supplying, refined sugar, which is what you have in those drinks. Refined sugar. Right from your mouth, there are enzymes there that help you to absorb them, metabolize them. So almost immediately you feel good and you come up. They supply immediate strength. That's what happens in that case. But as per the other caffeine itself it makes people to come alive, so to say. It's also in some other agents that are close to beverages, coffee or sort of coffee.
Yeah.
And that's why people take them early in the morning so that they can become sharp. So all those things are there. But as long as you take them within limits and they are not harmful, they are not harming you, then it is not an addiction. Mind the specific words in addiction. It's a problem at the level of the brain that is making this person to impulsively and compulsively want the drug or the agent, then use it despite the fact that he's aware that this thing is harmful to him. It's recognitive harms. And it's not only drugs that can be
An addiction.
All
right, thank you, Doctor. We've heard from the doctor, we've heard from our two analysts. But for now, let's go on a short commercial break. We shall be right back. Welcome back. You are still on your show, Spill It on Afric HTV. And Doctor, I have this question. At what point can we call someone a drug peddler? Because I could say, I needed money, I have responsibilities to take care of, this person needs this drug, let me just get it for him, this and that. So at what point can someone be tagged a drug peddler?
Okay. I might not be a specialist in that area.
Okay.
Maybe that could have been better answered by somebody who works with NDLEA or somebody in the security unit that deals with that. But I want to, in my opinion, anybody who goes into transportation, selling, packaging, getting it through to whoever wants it, of an illicit drug, banned drugs that are not legitimate, could be tagged a drug peddler. Because such a person even knows that he's doing something that is illegal. If a drug is banned from the country and you are still carrying it around, then you're a drug peddler. You must be using it for the wrong reasons. Because for any drug to have been banned or to have been stopped from coming into the country or from being
in circulation,
sold, and even some drugs are also drugs of prescription to prevent people from having direct access to them. I don't want to mention examples now. If you don't go to a pharmacy shop with a prescription from a doctor,
some drugs will not be sent to you.
Drugs will not be dispensed to you.
And
even some are limited to certain hospital environments. You are not supposed to get them over the counter anywhere else. So if you are in possession of such drugs and you are taking them around, by law, I think the issue of drug peddling relates more to law than to science. Let me stop at that.
All right. About any idea on that?
Well, we are the society, and we know what happens around. Just like Doctor rightly said, I know very well that there was this time I was seriously ill, and a certain drug was prescribed for me, and when I got to the pharmacist, he insisted, on the
drug prescription,
on a letter, a kind of prescription from a renowned medical practitioner, and I had to provide that, and after giving him the drug, after giving that, he had to give me the drug to use. And at the time too, I once had a cousin who was seriously coughing, serious cough, and the doctor had to prescribe a certain substance, one of those substances that some of these youths are abusing. So he prescribed the substance. That was how I got to know about that substance then, and it shocked me that even right now you see some youths, they are always handled with such substance, and I keep wondering for what purpose. This substance I know is for acute, health situation. So why would you be,
with it without
using this drug without, having such ailment? A whole lot is happening in our society. Right. But I can tell you of the fact, when I was growing up, I later discovered that many of these are, syrup, cough syrups. You don't use them when you are doing a factory work, because something happens to you after taking it. You will sleep off.
Yeah, you get
most of them.
You feel dizzy.
So
I don't want to mention the name of that drug, but it's one popular drug. Then when I was growing up, because of the sweetness.
We want to take it in excess.
I was just taking it, and it wasn't meant for me. It was meant for my for my younger brother. I was just taking it. I was just taking it, and lo and behold, I was supposed to go for evening class, like a Shagura lesson.
But you slept off.
I slept for more than 3 hours. Missed the class, and when I woke up, I was so weak.
Yeah, that's
and something in me, just told me that thing you took cost this, and I took my time and I carried the syrup. I had to read the inscription on it, and I discovered there's an instruction there that if you are going to take it, you are not supposed to do any serious work like factory work. You are supposed to and I now notice that it is 6 hours, 6 hour difference in taking such drugs, and especially when you want to go to bed. You take it when you want to go to bed. So that's just the thing about my own knowledge about this.
Okay. Chiamaka, do you have anything to say on that?
I will actually say once a person gives someone a harmful drug, that is XX, or maybe taking it for fun or anything, you are just a peddler. I will just say that you are just a peddler. Whether your peer groups, maybe your friends, anyone gives you any substance, a drug, medicine, anything illegal, anything, you are just a peddler.
All right, thank you, Chairman.
Moderator, please permit me.
All right.
Now that we have a professional medical practitioner in our midst, I want to know, because this situation often happens. You see people complain of certain ailment, and you see, some other person will just come up with some certain combination. Like, go and get this, go and get that,
concussions,
get that, use it, and that doing you will be over. I'm always scared of such. And some persons will tell you that they took it just like the person prescribed, and
and they were fine. They were okay.
I don't know what you have to say. Can we refer to that as
drug abuse?
That is drug abuse, obviously.
Okay.
That's drug abuse. I must tell viewers that the major thing in medical practice is your ability to establish a diagnosis.
Okay.
Somebody is ill. The fellow should see a doctor who will take history. When last were you okay? Go through the history and then find out when did this start, how did this start, the pathway. And then examine you. Maybe request for some investigations to be able to say this is the problem and this will be the solution. The solution may not even involve drugs. It might just be a piece of advice. Don't do this, or things like that. But for those who are just packing all sort of drugs, they do what we call multiple barrel approach. If it is not this, it will be this. If this does not work, this will work.
Trial and error.
So they keep going after the symptoms. But what you are supposed to do is to establish what is the cause of all this. Let me give an example. If a person is infected with malaria, the fellow will develop what we call malaria fever. The body will become hot, you will have a headache, body pains, loss of appetite. The fellow might even vomit. You understand? So if you want to start giving drug for each one, so give one drug for vomiting, give another drug for body pain, give another drug for headache, give another drug for fever. You understand? Even at times you then find out that they are even giving the same drug of different mix. I don't want to mention any names now. Okay, for example, they might give 2 or 3 brands of ibuprofen because they have different colors and different names. But the same content to the same person. And at the end of the day, the fellow will develop, an acute gastritis, so to say. Because these are overdose, the fellow does not need it. They are not even asking for something. There are things that you need, but we may not give you as doctors because you have another thing. What we call comorbid condition. That drug, there's a puzzle. This drug, you need it, but because you have this, you can't take it. So we need to look for an alternative for you that will not affect that your ailment that you already had before having this episode. So it's a form of drug abuse, and people do it a lot. And because, like the Yorubas will say, that when you curse a child before an iroko tree, you'll be looking back, thinking to happen immediately.
The iroko tree will fight the same day.
You understand? It doesn't happen that way.
Yeah.
Those things you are doing today, the drug abuse of today, will have its effect in the future. When we get to the futures, we'll talk more about all this. And you will see that you can picture some people who are very close to your environment who had gone that way, and they have that trend.
Exactly.
All right, thank you very much, Dr. Almoba. Thanks for that question. All right, Doctor, I know you are not a lawyer, you're a medical practitioner, but I know that you do consult as in consultancy. When I need something, I come to you. You enlighten me. Now, are you aware or do you know of any international law against all these things we have said, drug abuse, drug addiction, drug peddling?
Okay.
Do you have any idea?
Yes, I may not be able to quote specifically, but let me put it this way, because we also do elements of law.
Okay.
Let me grade it this way. I must tell our viewers at home that the law of the environment supersedes the law of any other place.
Oh, of course.
The law of the local government supersedes that of the state, because that local government. That's why if you commit a crime in a particular place, run to Abuja, they'll bring you back to that place to try. You understand? So the law of Nigeria supersedes that of even America when you are in Nigeria.
Okay.
So we have our laws and we have establishments, government organs that are they have legislative backing to handle all this, be it drug abuse, be it drug peddling and all this. They are there. Like the NDLE that we mentioned. That's why they stay on the highway, they arrest people who are in possession of this, the drug peddlers. And if they find people who are into this, also the drug abusers, especially when it is illicit drug like marijuana, like all this, Colorado and the likes, they arrest them, not only because they want to prosecute them, but because they also want to rehabilitate them. You understand? Because they will become problems to themselves and then to the community. So the nation has laws. There are international laws. That's why if you peddle drug, if you traffic drug across borders, you'll be arrested and be dealt with according to the law of that land. If you're arrested in Nigeria, there's a way they will prosecute you. But in some other countries like Indonesia and the likes, or Iraq, or Saudi Arabia, they behead you. You understand?
Education.
So, for you to know that each country has its own law. The way they handle it in each country is what will apply wherever you are caught. So if you escape from somewhere and you are caught in another country, the law of that land will apply to you because that's where you were caught. So there are laws, taking care of all this, including the abuse. It's only people are not activating them, maybe for personal reasons. If you go out now, we start arresting those who are, selling funny drugs to people. They say you don't want them to eat, the economy is bad and all those things, you understand? Which should not be. That's frank quackery. Because there's a body that is saddled with that. The Pharmaceutical Society of Nigeria is supposed to handle things that are related to drugs. That's why even chemists are supposed to be licensed. They are supposed to serve under a pharmacist to be visiting them, overseeing what they do. And there are drugs that they can dispense at that level. Other ones you then have to be at pharmaceutical shops where you have a pharmacist who will control things there and see to it that the wrong things are not done. But in our country, what do we have? People want to cut corners.
But sir, sorry, moderator. While Doctor was talking about these laws, something just came into my mind and I needed to clarify it. Some person said that some of the content of some of the drugs we use contains cocaine. How true is that?
Yeah, there's a particular drug that I know of. Don't mention it.
That's one. Then again, in some parts of America, in some states in America, maybe 2-3 years ago, they had to legalize marijuana. Why is that?
Okay. For every cocaine, let me delve briefly into the history of cocaine. Cocaine, when it was discovered earlier on, is an analgesic. It's actually a local anesthetic agent. It was used on the eye so that they could operate on the eye. But that is no longer so because it damages the cornea after all. But it will not make that fellow feel pain. Before people started diverting it into so many things. You will see that in medical practice today, we don't use it. You can't find it with me now and I'll say, because I'm a doctor, it's local anesthetic, I'll be prosecuted. It's no longer here. And another important thing is whatever other thing that people are claiming that they have such content in, as long as it's not written on it, I'm sure nobody will declare that I have cocaine in this thing. Nobody will declare that.
Get your premium quality chicken at Fumad Farm Limited. In need of valuable and hygienic chicken for your event and personal consumption? Then we got you covered. At Fumad Farm Limited, we breed the finest bird with consideration for health values. Are you in need of broilers, layers, and cockerel? Do not hesitate to patronize us. Our frozen chicken are well processed with accurate preservative method. Fumad Farm is located at 22B Oloroshogo Obokun Avenue, Ilesha, Osun State. For more inquiries, call 081 3855 8382 091 6634 9956 081 6587 2858. Fumad Farm Limited. Quality meets satisfaction.
So it is not normal for a company to declare that they have cocaine as a content of any drink. But in the case of marijuana in the UK, it's been legalized to be encapsulated. It now exists in capsules so that they can dose it as a form of analgesic in the UK. And I also learned that in some states in the US, if you are holding the one you want to use, but not for sale, so maybe they are trying to eliminate the aspect of peddling, but there's a certain quantity found on you that is legal in some states. It is for your use, maybe because of the analgesic effect too. But it's all around control. When it is well controlled, then people are likely to abuse it less. Laws don't eliminate crime. Criminals will still exist who will break the law, no matter what law you make.
Criminals will still exist who will break the law.
All right, thank you, the doctor. You are still on Spill It on Afric Edge TV. And here I still have with me our guest speaker, Dr. Adidakpo Omonola Adetoye. He's a consultant of analgesic at Obafemi Awolowo University Teaching Hospital Complex in Ile-Ife, in Osun State. And also with me, I still have Omoba here with me and Chiamaka. Dr. Adidakpo, what is the health implication or implications, as the case may be, of drug abuse, drug addiction, and drug peddling?
Okay, let me dismiss that of drug peddling straight away. There are peddlers who don't take the drugs themselves.
Yeah.
They're only interested in the financial gains. So that's the implication. So they're only endangering the health of other people. And that's one of the things the abusers and the addicts should realize. That some people for financial gain are trying to destroy their lives and their future. So let's go to the drug abusers. The majority of the people who will be listening to me now are actually drug abusers. It doesn't mean that you're taking cocaine. When you abuse analgesics, sleeping tablets, I don't want to be mentioning names now, and so on and so forth, you are damaging some organs in your body, because those things are, there's no drug that doesn't have side effects. They have their side effects, and that's why the doctor considered all this before giving you. And in case you have complaints, is waiting to have those complaints and to mitigate them. At times you had two drugs from the doctor. One is the active agent he wants to use, and another one is to counter the side effects of that one. That's why you had two drugs, not because you need to. So those things are there. So for those who are just buying drugs all over the place, shajo, all sort of drugs colored, and you are taking them, you are risking your health. Most of those analgesic could damage the kidney, and we've been seeing it happen. Those who take Mawu, I just want to mention a few common ones. You know, steroids that are used to fatten animals on farms, people take them, and you see them, they will now get fat, and it's the upper part of the body. What they will develop is called Cushing syndrome. So they have the Cushing gut fascia. You see like a humpback. They will develop striations, which you call stretch marks, all over, easily bruisable skins. A little thing will touch them and it becomes a whole lot. They suppress their own immunity, so they are susceptible to infection, and so on and so forth. Let's go, because of our time, let's go to addiction now. when you see somebody is addicted, a lot of signs will come up in them. Most of these drugs, amphetamine, cocaine, all those things, they suppress your appetite. And when there even drinks, alcohol, because there's a sugar in alcohol that the body cannot use, but the brain can sense it. So the brain senses it and feels that you're okay, that you are fed, you have enough sugar in your system, so you won't be able to eat. And that way, the body will then be breaking down the reserve. And so you see the fellow losing weight. You see the fellow locking up himself, coming up with unusual behavior. You know, some of them could be depressed. In fact, there are drugs that people take now, they convulse because of the metabolite. You know, when those things are broken down in the body, for example, tramadol, you know, the metabolite, what body converts it to, will make the fellow convulse, who has not been convulsing before. So it damages the organs, especially the liver. The liver is one of the great organs in the body. It helps us to detoxicate whatever we take. It removes dirty things from the body and pushes all those things into the gallbladder in form of bile.
Is this same with all this other substance like Colorado, loud, ice?
All those things go through the all of them go through the liver, where they are metabolized. And when the liver is overwhelmed, it becomes a problem. The liver gets damaged. And when the liver gets damaged, a lot of problems will occur. The liver produces majority of our clotting factors that help us to stop bleeding spontaneously when we sustain injury. It's the one that removes the dirty things from the body, like I said, from whatever we eat. And so when it is bad, you can imagine all those dirty things going into the system. That's why the fellow will faint. It produces, the plasma proteins, and if